Hey everyone, I'm Rena Malik, a urologist and pelvic surgeon here. Did you know that about 52% of men between 40 and 70 deal with erectile dysfunction? What that means is they're not always able to have penetrative intercourse whenever they want. So it's no surprise that there are so many sexual enhancement pills out there, often called sex pills for men. But do they really work? What do they contain, and should you even consider trying them? We're going to take a closer look at all of that. And if you find this helpful, don't forget to subscribe and give this video a thumbs up. Just as a disclaimer, I don't recommend these supplements. However, I know many people are using them, and it's important for you to understand what you're putting into your body. I also strongly believe it's essential to see a physician for a proper diagnosis and evaluation of erectile dysfunction. Sometimes, it can be a warning sign of serious conditions like heart disease or blood vessel problems. It can also help identify issues like low testosterone. Getting checked is important. Plus, we can prescribe medications that are regulated by the FDA for erectile function. There's really no such thing as a medication or supplement without side effects. Many people assume these supplements are all natural, and while some may be, we often don't truly know what's in them, and they can still cause side effects. That's not a good reason to skip seeing a doctor. The biggest concern with these supplements is that they are not regulated by the Food and Drug Administration. There's no governing body verifying whether what's listed on the label actually matches what's inside the pill. So, even if the ingredients I'm about to discuss seem safe, they may not even be what you're actually taking. You need to be very cautious. And on top of that, some of these products can be quite expensive. I remember that in the past, medications like sildenafil or tadalafil, better known as Viagra or the blue pill, used to be quite expensive, which made them hard for many people to afford. But today, these medications are available in generic forms. If you visit a physician, you can often get a generic prescription, and many times, there are coupon programs or compounding pharmacies that offer even deeper discounts. So cost really shouldn't be a major barrier anymore when it comes to treating erectile dysfunction. The first product we're going to talk about is called Libido Max. Right on the front label, it claims to be a doctor-developed male enhancement pill. However, when I checked their website, I couldn't find any clear information about a physician who actually developed it. So it's unclear whether that claim is even accurate. Also, directly from their website, it states, "This product contains a chemical known in the state of California to cause cancer and/or birth defects or other reproductive harm. Based on that warning alone, I would strongly advise against taking this product, since there's a potential link to harmful health effects." The first active ingredient in this supplement is L-arginine. You'll notice this ingredient appears in many of these products. It acts as a precursor to something called nitric oxide, which plays a crucial role in achieving an erection. Nitric oxide helps relax and open up blood vessels, allowing blood to flow into the penis, leading to an erection. Without it, an erection simply can't happen. So in theory, L-arginine sounds promising and could potentially help improve erections. However, studies on this ingredient show mixed results. A daily dose of around 5 milligrams may offer some benefit, but it seems to work best in individuals who already have blood vessel-related conditions. In those cases, it may help improve circulation. So for people with cardiovascular issues or other vascular diseases, it might provide some support. That said, there are also several possible side effects associated with L-arginine. And interestingly, most of these supplements don't clearly mention any of those risks. But when you take a closer look at the individual ingredients, they are actually known to have side effects. These can include cramping, nausea, abdominal pain, or bloating. So it's very possible you could experience stomach or belly discomfort when using this product. You also need to be cautious if you have a history of asthma. Conditions like asthma or reactive airway disease can actually worsen when taking anything that contains L-arginine. In addition, if you have low blood pressure, liver disease, or certain genetic conditions, this ingredient may pose risks. In those situations, it's best to avoid these kinds of supplements altogether. The next active ingredient in this product is something called horny goat weed. Sometimes you'll see it listed under that name, and other times it may appear under its scientific name, epimedium. This is an herbal extract that contains an active compound known as icariin. This compound is believed to help increase nitric oxide production, which may support erections by improving blood flow. However, there haven't been strong randomized controlled trials, meaning proper studies comparing it to placebo pills, to clearly prove that it works. So while the theory sounds promising, we don't really have solid evidence that it's effective. Another issue with horny goat weed is that it has low bioavailability. In simple terms, that means your body doesn't absorb it very well, and it doesn't stay in your bloodstream for long. Because of that, it may not be very effective. There are also potential side effects to consider. With long-term use, some people may experience dizziness, vomiting, or dry mouth. In more serious cases, especially with high doses, it can lead to muscle spasms or even difficulty breathing. So it's important to be cautious. Again, I keep saying medications, but these are actually supplements. They are not regulated by the Food and Drug Administration. That's an important distinction. You should also be especially careful with horny goat weed if you have low blood pressure, if you're taking blood thinners, or if you have any type of clotting disorder. The next active ingredient in this supplement is yohimbe, which is derived from the bark of an African tree, and it works through two different mechanisms. It also has a central effect, meaning it works on the brain by blocking certain receptors that normally reduce sexual arousal. In addition, it may help increase nitric oxide levels. This ingredient has been studied, but only in small groups of patients. Because the studies were so limited, they weren't large enough to clearly show a real difference between taking yohimbe and taking a simple placebo or sugar pill. So we still don't know how effective it truly is. If you're considering any supplement that contains yohimbe, you need to be cautious, especially if you have any psychological disorders, existing anxiety, prostate issues, diabetes, or heart conditions. In these situations, this ingredient could actually be harmful. The next supplement we're going to review is called Male Extra. This product contains two main active ingredients. The first is pomegranate. So the question is, does pomegranate really help with erections? There was a study where men drank pomegranate juice daily for 4 weeks and were compared to those who didn't. The idea behind this is that pomegranate acts as an antioxidant, which may improve nitric oxide availability, helping the body use it more effectively during an erection. However, the study didn't show any meaningful improvement in erectile function after those 4 weeks. So based on that, it likely doesn't make a significant difference. Also, if you're taking products that contain pomegranate, you should be careful, especially if you're on medications processed by the liver or if you have high blood pressure. It can interact with certain blood pressure medications and affect how they work. The next ingredient in this supplement is something we've already discussed, L-arginine. So overall, with Male Extra, I'm not particularly impressed. The next supplement we'll look at is Viagra. On its website, it clearly states that the FDA has not evaluated any of the claims made by the company, and that the product is not intended to diagnose, treat, cure, or prevent any disease. That alone should make you pause and use caution. Again, these supplements are not regulated by the Food and Drug Administration. So far, I haven't been very impressed with any of them. While some ingredients may show limited promise in small studies, nothing stands out as truly effective or conclusive. This product also includes L-arginine and horny goat weed, which we've already talked about. In addition, it contains something called maca. Maca is a root vegetable from Peru, similar in appearance to a radish, and it has been suggested that it may help increase sexual desire, and there is one study on maca where it was given to 57 men and compared to a placebo or sugar pill. The results suggested it may be somewhat helpful. However, it was a small study, so while it shows some promise, we still can't say for sure how effective it really is. One of the positives about maca is that it doesn't appear to have many serious side effects or clear contraindications based on current reports. The most common side effects tend to be mild, such as slight mood changes, some abdominal cramping, and occasionally trouble sleeping. But overall, there isn't a long list of major concerns associated with it. The next ingredient is ginkgo biloba, which comes from the leaves of the ginkgo tree, a plant native to China. It has been used for many years in traditional Chinese medicine. The idea behind how it works is that it may increase nitric oxide availability, helping improve blood flow. However, a randomized study comparing ginkgo biloba to a placebo found no meaningful or statistically significant improvement in erectile function. So, based on that, it likely isn't very effective. In addition, ginkgo biloba has several reported side effects. These include increased anxiety, a higher risk of spontaneous bleeding, and potential interactions with medications that affect the central nervous system, such as those used for anxiety or other psychological conditions. If taken with substances like St. John's wort or melatonin, it may even lead to what's called hypomanic symptoms, where a person becomes unusually energetic, overly alert, and may behave out of character in ways that can be harmful. So it's something that needs to be used very carefully. The next supplement is Max Performer. On its website, it carries the same disclaimer as Viagra, stating that the FDA has not reviewed or approved its claims, and that the product is not intended to diagnose, treat, cure, or prevent any disease. This is mainly for legal protection, but it also clearly highlights that these supplements are not regulated. This particular supplement contains 3 main active ingredients. One of them is maca root powder, which we've already discussed, and it also includes horny goatweed. And finally, it also includes Korean red ginseng, also known as Panax ginseng. This ingredient is believed to help increase nitric oxide production. Interestingly, it has been studied fairly well compared to some of the others. However, most of these studies were done on small groups of generally healthy men with erectile dysfunction, so the results may not apply to those with other health conditions. In one study involving 90 men, about 60% showed improvement. Those who responded experienced better penile rigidity, increased girth, longer-lasting erections, improved libido, and greater overall satisfaction. So yes, it may be helpful, but there are some important side effects to keep in mind. The most common side effect is insomnia. You also need to be cautious if you're taking it along with stimulants like caffeine or decongestants, as it can raise your heart rate quite quickly. In addition, if you have any immunosuppressive conditions, such as lupus, a history of organ transplant, or even diabetes, this ingredient may not be safe for you. The next supplement is called Advil, and it includes many of the same ingredients we've already discussed, such as epimedium, horny goatweed, ginkgo biloba, pomegranate, and ginseng root extract. The last supplement we're going to talk about is VGRX. Interestingly, this one has actually been evaluated in a clinical trial. There is a published study that specifically looks at this formulation and compares it to a placebo in men. This trial was funded by an Indian pharmaceutical company called Vedic Life Sciences. In the study, 76 men were divided into 2 groups. One group took 2 tablets of VGRX, while the other group took a placebo. The results showed improvements across 5 key areas: erectile function, orgasmic function, sexual desire, intercourse satisfaction, and overall satisfaction. One positive aspect of this supplement is that it has been studied in a structured, scientific way and published in medical literature. Additionally, this supplement is endorsed by a physician I was able to verify online, Stephen Lamb, who is associated with New York University School of Medicine. Because of that, there may be some credibility to this product. It appears to be sold in the same formulation that was studied. So, if someone were considering trying a supplement, this might be a more reasonable option. The study also didn't report any major side effects. However, it's important to remember that the participants were healthy men, So if you have other medical conditions, you should speak with your doctor first to make sure it's safe for you. What really matters is that men's health and the ability to have normal erections is important. Seeing a doctor can make a big difference. So if you're feeling concerned or unsure, don't wait. This is something physicians deal with every day, and we're here to help. If you've tried any of these supplements, feel free to share your experience in the comments. I'd be interested to hear about it. And as always, take good care of yourself.